Mike Clark, you're the CEO for Logan Regional Hospital. Tell me a little bit, brief history about why you started the Cancer Center and how it got started in the first place.
That's a good question. The Cancer Center, we started looking at the Cancer Center just after about the year 2000 and kind of started monitoring the number of patients from the valley that had to leave the valley in order to get their cancer treatment. And that was an important thing to look at because cancer treatments in radiation oncology, this is a linear accelerator that treats for radiation, does radiation oncology treatments, they have to go 5 days a week for 5 to 6 weeks. And so it's a lot of travel outside of town. And so we were kind of monitoring and seeing how many patients were leaving in order to get that service. We do that with most of our services in the hospital, kind of see, what things the community really needs and what can be supported by the community, because there's some expertise associated with most of our treatments. So as we were looking at that starting around 2000, we started to see that there were enough patients leaving that we felt like it was an important service to.
Was that a high number?
It was around 70 to 80 a year. And we've seen about that many people treated since we've opened the Cancer Center. We opened the Cancer Center in June of 2008, and we've treated just over 260 patients. And so there's been a lot of patients that have actually benefited significantly from the Cancer Center. I did a little calculation just to see what kind of benefit, and if those patients had gone to McCady Hospital, for example, for those treatments, they would have traveled close to 700,000 miles.
That's a lot of miles.
Yeah, it's a lot of miles. So we figured we're also helping the environment.
Yep.
People aren't driving, but the patients really benefit a lot by not having that added expense and the added burden.
Stress when they're already going through a lot.
And what's interesting about cancer is there's so many people that are affected by it. And when they get cancer, the whole community, their community, their family, their neighbors really come to support them because they help them drive down to wherever they're getting treated, or it's just it's an emotional experience for the family and for the individual. And we felt like it would be a lot better to have that service here than have people leave.
And you have a lot of machines that work here. They're expensive machines.
Yes.
How did the community help bring some of that here?
We had great community support. We did a fundraising campaign, and we were able to raise just over $1.2 million from the community.
That's a lot.
It's a lot. So we had some really significant donors that made really significant donations that were impressive. I was impressed and humbled by that people supported this adventure that much. We had the hospital employees actually able to donate $250,000. That's from housekeepers to the administrators. Everybody almost participated in that. And so it's really good community support for the facility.
I think it's a great thing. I know that when we get together as a community, we can do great things. How has this impacted, do you think, the local patients that you've seen come in here? How do they feel about that?
The patients have been very appreciative because they still go to McKay for one visit in order to do what they call simulation, where they do a lot of calculations on the tumor size and program the machine. And without just one visit, they're really happy that they don't have to do that every day. So the patients have been very, very appreciative of that, and we've been able to provide a good service for them here, and we have great staff.
And tell me a little bit about your Huntsman recognition thing that you've had.
Yeah, we recently received an accreditation. Intermountain and Huntsman have kind of combined efforts to treat cancer in Utah. And that combined efforts is Huntsman Intermountain accreditation, which we have to do certain things to make sure we have a good quality program. And so they come and they kind of look at our programs and make sure that we're doing things that both Intermountain and Huntsman feel like are important in order to treat cancer. We have an education center that's open to the public. We also
here at Logan Regional.
Right here at the Cancer Center. Then we have also other things that physicians have to work together and follow certain protocols and meet to discuss cases. Cancer cases to determine best treatments, and it's all local physicians that help drive that and make sure we have the best care for our patients.
Those are very important things. And what other services are here at the Cancer Center?
The Cancer Center, we also lease space to Dr. Ben Jacob. He's a medical oncologist, so he's the one that will do chemotherapy, and then the hospital provides the radiation therapy service.
And like you said, this is a very emotional thing, and it's all about, we're on a campaign to get a lot more people screened for cancer, but it's nice to know that we have somewhere we can go here in Logan. Would you not agree?
I would agree, very much so. Very much so. We've done a lot of commitment to the Cancer Center and to the community, and I think it's important that we continue to do that, and we continue to grow services to help the community out.
And thank you to our community for helping get this Cancer Center here. And thank you to you, CEO Mike Clark. I appreciate your time and efforts.
Thank you.
For sure.